Hi everybody, today's video provides lots of tips to help you prepare for a school nurse interview, so I hope you find it useful. So I'm going to go through some key background research and signpost helpful resources and websites that are useful to prepare for interview questions. I'll present some generic topic areas that might come up and some example generic interview questions, and finally how to learn from interviews and the feedback. So if we start with some background research for the interview, first of all, you need to know what type of interview you're going for. Is it face-to-face? Is it virtual? Is it a group interview? Does it require a presentation? Lots of more senior roles require presentations. Do you have scenario-based exercises to complete? And it should be clear on the invite what type of interview it is. I've got a few tips on preparing for value-based interviews later. Then you're drilling down on the specific role. What type of role is it? What are you expected to do? Which institution or organisation are you working for? Because there's a variety of school nurse roles. You could be employed by a local authority or a council. It could be a role working in the community setting. It could be in one school or an NHS trust. So what type of school is it? What type of pupils are you caring for? And what communities and populations will you be working with? It depends on the role. So drilling down on the job description and employer websites is very helpful. And going on through the job description, you can highlight key aspects of the role. So for example, several job descriptions that I've reviewed recently focus on the delivery of Healthy Child Programme and public health interventions. And it's useful to review that programme beforehand and to be aware of what the service targets are, what's the commissioned work for this service. And you'll see that on the employer website in the job description, and also you could ask for an informal visit or do a virtual meeting or just ask questions on email if you can't manage to get an informal visit. It depends on the sort of type of role that you're going for. The employer website and values are important to look at. Is there a shared value or mission statement on their employer website? I recently saw one that used a mnemonic people, and P was for person-centered values, which is great to know before your interview. You know, it could be a reason why you're applying even for that role. Informal visits are very helpful as well. You can book those through the recruitment lead, or you know, you might have been in placement in that area, you might already live around that area, but you can book an informal visit usually through email. And when you go, you have a walk around, you talk about the service, and you can ask them about their key areas of delivery, their focus at the moment. What are the current challenges? What do they enjoy about the role service? And again, that can be brought into an answer in an interview. For example, if you're asked, why do you want the role, or why have you chosen this specific school? You know, saying that you've been on an informal visit is really good in an interview. As I said, if you can't get an informal visit because you live too far away, or they can't offer one because they're too busy currently, then you can do virtual, or you can ask questions on email potentially. If you've got a presentation as part of your school nurse interview, I've got a free video on my YouTube channel with lots of tips that might help how to structure a presentation. And you often have to do a presentation if it's a more senior position, for example, or there's lots of competition for the role. So I hope that video helps. Another key part of your background preparation is important to review key healthcare terms and definitions. So for example, you might be asked a question where somebody uses the word audit or evaluation or quality improvement or clinical governance, and you can go blank in an interview if you haven't revised those terms or not, you know, recently read around those areas. And that puts you off answering the question, and you probably know the answer on reflection after the interview. So it's important to revise those terms. So for example, lots of job descriptions out currently have got regular auditing as part of the role, or risk assessments, or they talk about key performance indicators if it's a senior role, service evaluation, or quality improvement. So it's very helpful to revise some of those key terms just so you've got them in your head before you go to the interview. Reviewing the job description again helps because you can highlight key terms and key areas in the role. Also revising local, national standards, policies, frameworks and guidance. Again, they might be quoted in the job description or on the employer website, but have a look at what's out there currently linked to safeguarding safeguarding, child protection, child and adolescent mental health and wellbeing, clinical governance and professional guidelines. And you'll see up-to-date resources on national and professional websites. Another area is key topics or areas of interest. They might ask you about, what you've read recently, or, what's the current topic in the area. And I know currently in England we've got the campaign for a school nurse in every school, for example, so that would be a good example. Some helpful resources and websites to signpost for your interview. The School and Public Health Nurses Association website's got some excellent resources. The Royal College of Nursing, there's an RCN toolkit for school nurses that's going to be updated soon, but there's other resources on their website. For example, the Paediatric Early Warning System, Pew's observation and escalation charts. Nursing Midwifery Council website has the standards of proficiency for specialist community public health nurses. The Queen's Nursing Institute website, lots of resources on there and pages for school nurses. There is the Transition to the School Nursing Service Toolkit and Resource Guide for nurses new to the role. Government NHS website, so we've got the Healthy Child Programme schedule of interventions on the gov.uk website, and you can download that with community, universal, targeted specialist intervention, so that's good to have a look at. There are other resources and websites out there, but that's a great start. So you've got your NICE guidelines, obviously, from the National Institute of Health and Care Excellence as well. So there's a few websites to get started. I mentioned earlier about revising key terms, and I've got some simple videos on my YouTube channel that give an overview of these generic terms and practically apply them in case you're asked questions about quality improvement, risk management, audit or education. I've also got a playlist on leadership with lots of helpful videos. They're all free on my YouTube channel. The leadership ones are very good if you're going for a sort of more senior position, but these are good just to get an overview of some of those key terms before your interview. If you've got a value-based interview, it's also helpful to prepare key case examples linked to areas such as compassionate care. For example, you might be asked to talk through an example from your previous practice of how you promoted compassionate care, or evidence-based practice, or quality standards, or research, or how you integrate evidence-based practice into your care. It could be about quality improvement. So it's really helpful to have prepared your best example if you're asked for one. Also look at team working, leadership, organisation, management. If you're going for more of a leadership post, they might ask you for an example where you've educated somebody or supported somebody, you've promoted health promotion, dealing with a challenging situation. So these are some example areas that you sometimes are asked for an example. It's helpful to review the teams you'll be working with, because you're an autonomous practitioner, but you're going to be working with multi-agencies. You might be referring families and children to different agencies, for example. So check on the job description if you're unsure, but do a bit of revision on that. Also, if you're in a larger team, potentially you might be working with healthcare support workers or assistant practitioners or nursing associates. So it's helpful to know the differences between those roles and the differences between responsibilities in the supportive roles that you'll be working with. Looking at what types of different services are you working with: charities, local national support networks and agencies that link to the school. You could have child and adolescent mental health, wellbeing support and public health agencies, for example, or support services for children with additional needs. So it's helpful to have a look at those before interview as well. In the role, if you're working with supportive roles such as a support worker or nursing associate or assistant practitioner, I've got a video on my YouTube channel that explains the differences between those supportive roles and a registered nurse role. So you might find those helpful if you're working within a team that utilises these supportive roles. If you have a value-based interview, don't worry at all. You just need to think about those examples. So the previous slide, I gave you a list of areas potentially that link to value-based interviews, where you might prepare an example on team working, for example, or compassionate care. But value-based interviews aim to select interviewees who align most closely to the values required in the role. So the interviewer will start with one value-based question. So, for example, talk me through an example where you provided compassionate care in a previous role or placement. And then interviewers will drill down with some more specific questions about the example that you've given. So a few tips if you've been called to a value-based interview. The value-based interview examples should relate to you and the impact you made. So you don't just talk generically about topic area and what other people did or what you observed other people doing. You want to be talking more about what you influenced in that scenario or that example, the impact you made, the difference you made to that situation. It's also important not to make the example up, as you might be asked to recall details. So with value-based interviews, as I said, they start with one main question, you give your example related to that area, and then they'll start asking you questions to drill down on that example. And it's very helpful to prepare those examples beforehand. And as I said, I've given you a list of some key areas that are helpful in an earlier slide. So if we now look at some example generic questions in topic areas that you might be starting to prepare for. In any interview, you are bound to be asked somewhere at the beginning, why have you applied for this role? So why have you applied for this school nurse role? Or what attracted you to this role? What led you to apply for this role or to this service or to this employer or school? Tell me what you know about this school, NHS Trust or community setting service. So all the previous preparation I suggested earlier, looking through the job description, going on the employer websites, is going to help you answer that question. They want to know that you've done your research about the role, the service and the employer, and they want to know you're the right person for the role. You can talk through education that you've had, the specialist community public health nurse course, or postgrad diploma that you've done. It's all leading you up to applying for this role, your passion to work with children, to make a difference, health promotion, whatever it is that has led you to apply. But reflecting on that answer before you go to the interview is helpful. What key skills are required in the role, or what key values do you have for the role? And again, the job description should highlight the key skills. You should have the core knowledge and skills from your registration as a specialist community public health nurse. But of course, usually employers are looking for a good communicator, somebody who's empathetic, organised, systematic. You've been able to problem solve in emergencies as an autonomous practitioner or in challenging situations, and someone who's professional and is adhered to policy, the evidence base, is a safe practitioner and adheres to risk assessment, safeguarding policies, for example. So have a think about how you would answer some of these questions. Another classic question, why should we offer you this opportunity above other candidates? Again, something that can be asked in any interview. And you're marketing yourself here, so reflect on your core transferable skills, your passion, the knowledge you've developed, past experiences that align to this role, where you've promoted health, you've taught others. You're trying to get the things that you're going to pick here, because you don't want to talk too much, but what you're wanting to do is to bring in key examples that highlight your strengths. And any QI projects, quality improvement projects, any staff recognition awards, something that you've made an impact, a simple talking through, where you've made an impact to staff or to children or to adolescents. But you're trying to sell yourself here. So some more generic questions. What are your strengths? And that sort of links to the last question as well. If you're offered the role, what challenges do you envisage when you first start? Or tell me about a time when you overcame a challenge or learnt from a challenge. And what they want to see here is that you're a reflective practitioner and how you've moved forward, how you've educated yourself. Another classic question, how do you manage your work-life balance? What strategies do you use to manage stress at work? As an autonomous practitioner, the employer asks these types of questions to know that you can manage your caseloads. So before the interview, reflect on all the strategies you use. How do you know when you're becoming stressed and you acknowledge when you're beginning to feel stressed? How do you manage? How do you switch off in your free time? How do you utilize support, escalate issues and concerns to your manager if needed? And then, so think about how you would answer that sort of question. And then, where do you see your career in 5 years' time? And that's very individualized to the candidate. The questions you're asked might link to quality care or key performance indicators in the role. So give me an example where you've delivered compassionate care, quality care, an improvement in care, or you've made a difference to a patient, child, adolescent or staff for maybe an early career school nurse role. or tell me about core aspects of the role. If it's a senior role, you probably will be asked something on key performance indicators, but also for junior roles, it's important to know what's the role being measured on, what are the key outcomes I've got to achieve in this role. So they might ask you about the Healthy Child Programme schedule of interactions, for example, targeted interaction, community or universal interaction. How do you know when you've delivered quality of care? So how do you evaluate your care? How would you evaluate the quality of your care in your role, or the quality of your work in this role? How would you evaluate the quality of this service as a senior role? So think about how you would answer questions on quality care. I've got lots of videos on quality evaluation, but also if you're going for a more senior position, preparing for a band 6 or 7 senior nurse role, quality improvement projects, developing leadership skills, teamwork, coordinating nursing care. All these videos are free on my YouTube channel, and if you're going for a more senior position, you might find them helpful as well. So some generic questions on support, training, education. How do you keep yourself up to date with research, the latest evidence? And the interviewers want to know that you're a reflective practitioner, a lifelong learner who provides evidence-based practice. So have an example there maybe where you've used up-to-date guidance or procedures recently, or you incorporated evidence-based practice, evidence-based care into your practice. Give an example where you educated, supported a child or adolescent or a staff member or group of staff, and how this impacted on them. How would you plan a teaching programme for school teachers or groups of adolescents? And they may even give you a specific example linked to the job description or an aspect of the role that you've applied for. What would be your first 3 objectives if you were offered the role? How would you ensure the learning needs of your team are met if it's a more senior role, or promote compliance with statutory mandatory training if it's a more senior role? And think about how you would answer some of those questions. Usually you've got some scenario-based questions that will link to the role, so it's helpful to look at that job description. Essentially, in scenario-based questions, employers are looking for problem-based skills, problem-solving skills, your communication skills, that you're professional, you're safe, you're adhering to current standards, and the evidence base linked to safeguarding, child protection, for example. So a few example questions, you never know what's going to come up, but sometimes you might get an acute emergency type question. What would you do if you found a child having a seizure, a child that had slipped, had a severe head injury or concussion, who's hypoglycemic, who's gone into anaphylactic shock, or is choking, or is non-responsive, they might have taken an overdose. With any of these types of questions, you're looking at a systematic approach, so A, B, C, D might be a helpful way to structure an answer. I'm not going to give you the answers to these, but think about how you would answer such a question. And then you've got the sort of less acute that might link to health promotion or education. So a 14-year-old adolescent comes to you for advice and thinks they might have a sexually transmitted disease. What do you do? Or there's an outbreak of lice in the school. What do you do? So the school might have a sexual health nurse alongside school nurses, but you're using a holistic approach. You're assessing the needs of an individual or a group, depending on the question, and being systematic and adhering to safe national guidance, local procedures. And then another sort of type of question might be medication questions. So an adolescent might request emergency contraception, and some schools offer those. So have a look to see, it's usually in the job descriptions. There is a Royal College of Nursing position statement and advice about this, the role of school nurses in providing emergency contraception services in education settings. But it's quite a good one to look up before an interview. And some nurses will use patient group directives. You must be competent to do so to be able to administer certain medications. So you may get an administrate drug type question, administrating medications relating to a particular scenario. If you have not got the competencies signed off, then you have to say that, so they might be testing that, or about something about control medication, control drug medication, and administration. So it's good to have a think about some of those questions. Thinking about some potential safeguarding scenarios, or something linked to child protection may come up. So talk me through GILIC competence, and how this would be applied in this situation. So thinking about this medical law, you're deciding whether a child's able to consent in their own medical treatment without parental permission or knowledge in that situation. And they may give you a scenario linked to that. So revising GILIC competence is important if you are working with adolescents. How would you support a 12-year-old child who has severe bruises and other potential signs of abuse or signs of an eating disorder or deteriorating mental health? So again, using that holistic approach, individual needs, person-centered, empathetic, brings in safeguarding, risk assessments as their safety is paramount here, recording data, escalating, referrals. I'm not going to answer the specific question, but there's lots of things you can sort of bring in to these sort of scenario-based questions. Talk me through the services you would access if a child's mental health had severely deteriorated. So to answer that question, you need to think about those services and be aware of the available services. And then something linked to confidentiality might come up. So your case notes look like they've been tampered with, or you witness a potential breach in a child's healthcare records. What would you do? And looking at escalating concerns, something to do with incidents, might come up as well. Thinking about answering questions on health promotion or education, a scenario might be given. Again, it depends on the role and whether it's a school-based role or a community-based role. But you could be asked, how would you go about setting up or planning early interventions relating to whatever it would be, or health assessments, or vision or hearing screenings, or an immunisation programme. So if you see one of those in your job description and that's part of the role and you have to deliver that, you may be asked about how you would go about planning it and delivering it. And it might be in a school or across a community-based population, and talk me through how you would plan this programme or meet a target. And that's where going through the job description, talking to recruitment leads or having an informal visit might give you a few more insights. You might be given a scenario, you need to educate all teachers about a new support service for children who have dyslexia. How would you go about setting up or planning this teaching? And it's thinking about things like assessing when teachers would be available, linking to the head teacher, deputy for advice, thinking about the mode of delivery. Does it need face-to-face teaching? Could it be virtual? Could it be delivered on an inset day when children are not in? Or does it need to be shared now whilst in the middle of term? It's so important. Who's going to deliver the teaching? Could a charity come and do it? Could somebody else do it? Are there additional online resources? So just a few example things to think about there if you're planning teaching. Another classic question, how would you plan an assembly or group activity with pupils to promote awareness of something? I've put risks of vaping, but it could be on anything. And you're thinking about holding their attention, interactive session. You might bring in people that have vaped, who've damaged their lungs, young people, youth videos. But if that's part of your role, you could be asked something about that. There's lots more potential questions. None of these questions that I've given you may come up, but it's just getting you to think about when you're preparing, there will be some sort of key topic areas that might come up. So I hope you find some of these example questions helpful. So any school nurse position is competitive, and there may be a chance that you're not successful at interview. However, you are going to learn so much from doing an interview, and it's very helpful to reflect on that feedback. And I know when I went for a team leader post, I was so disappointed. It took me 3 goes at the job, 3 interviews to be appointed. But I learned from every interview, and thinking about it, the first job probably wasn't right for me. The second job, I didn't really particularly wasn't that enamored with the team when I went on my informal visit. The third one was the right job for me. And sometimes you may very well be appointable. You might have done an excellent interview, but somebody else had a few more points than you at interview. So it's important to learn from feedback and to request it. And when you're first phoned up, you can be quite upset because you've spent a lot of days, or hours preparing for interview. But it's helpful to try and ask them, because you've got that opportunity with them on the phone. What were my weaker answers? What were my stronger answers? Or how could I have improved my answers? Or which areas do you think I need to work on with my questions? And then you can reflect on that interview feedback, and it'll inform future interview preparation. It's also helpful to write the questions down, because if you go for another interview 6 months down the line, you might have forgotten the questions. And you might be able to book a mock interview with a senior nurse if you give them enough advance notice. If your technique at interview, was poor, you got feedback that, your questions weren't structured enough, for example. So it's helpful to get that mock interview feedback. And it's perfectly acceptable to do that as long as the person is not on the interview panel or part of that service. So do utilise mock interviews if you can as well. But hopefully that will help you for future interviews. So good luck with your interviews. I hope you found this video helpful. Don't forget to give it a like if you did, and if you need to contact me, you can put questions in the YouTube comments, or you can contact me on Twitter. If you want to buy one of my books, you're welcome to. I have a book on how to prepare for interviews and develop your career for nurses and midwives. And if you do feel that you need support with your interviews, you can get the book in the library if you can't afford it. But the book is helpful. It's got personal statements and lots of prep for interviews as well, if you feel you need development in that area.